Hello and welcome to the Faces of Mental Health. I am Julian Mpatse. In this episode, we'll be talking about health, nutrition, mental health, and everything else involved in taking care of ourselves. And my guest for today is Joshua Leteka. He's a biomedical scientist. Joshua,
Yes,
welcome to the Faces of Mental Health.
Thank you so much, Ma'am.
So tell us about the whole aspect of food and health. I've heard that good nutrition starts in the gut.
Definitely.
Can you tell us more about that?
Definitely. As you rightly said, I'm Joshua Leteka, a biomedical scientist. I studied biochemistry and food science at the University of the Free State. And normally when you finish your first degree, you don't know what to do. All you do is apply. I did that, came back home, applied to the Ministry of Trade because I thought I would further my skills in quality management. In food, one of the main things is to manage bacteria, microorganisms, and I chose to specialize with quality control, quality assurance, and quality management. So knowing that at that time, around 2013, the government was big on developing Bureau of Standards. I came with all the energy, but they put me on a long waiting list. I'm still waiting. But nonetheless, an opportunity came up when the government was shifting the investment and focus into medical cannabis. And I got an opportunity to work in one of the first medical cannabis industry company. It was called Medicro then. I think now it's MG Health. So I worked as an assistant pharmaceutical quality assurance officer. So that is where really I got exposure into health, therapeutics, and how to manage quality, what to do as a quality assurance officer. And yeah, that is where really I got in-depth knowledge about the chain, the quality chain of drugs and their development. So, but whilst learning about drugs formulation and things like that, I couldn't help to neglect the fact that with every drug that is developed, there's a side effect. So it's it's more like the tree of the knowledge of good and evil. Right. You get two for both. So, and you are lucky if the side effects don't really outweigh the good. Now, being in a place where as Basotho we eat anything, fries, magwenya, papa, and very less of herbs. What happens is when we take these drugs, the side effects that would be tolerable, they knock us out. Having worked now in supplements, which is what I do, helping parents to understand that really it's through diet that you could maintain good health. In fact, from our perspective as biomedical scientists and in my niche where I focus on supplements and micronutrients, the way we see health is we see health and disease as as a deficiency of some nutrients. So you would, in short, you would never be sick. No one would ever be sick if their body had all the nutrients, because the nutrients are the building blocks that would then empower your immune system and aid in the neurotransmission of chemicals in the body. So how the human body functions is it takes the nutrients at the micro level, processes them, and if the whatever micro atoms are there, whether they are toxic or beneficial, the body has to decide, and the liver and the kidney play a big role in managing toxicity. But now what happens when you flood your body with all these toxins from hydrocarbons from the cars, toxins from even prescribed drugs? They have their own toxins. Foods that we eat day to day have their own toxins. The lotions we apply, deodorants that we apply. I think your listeners have to be aware that they have lots and lots of aluminum. You apply it to your skin, it ends up in your brain. By the time you know it, when you're 40, 50, you don't know where you last placed your key. Why is that? The communication that used to flow so swiftly and easily when you are younger has now been overloaded with toxins. Things like dementia, Alzheimer, have all the people, the researchers and scientists have now come to agreement that all of them are caused by heavy metals. Mercury, aluminum being one of the leading factors. And now in America, as we speak currently, there's a committee that is reporting to the parliament. This current administration, one of their focus, and I think it was a week ago when President Trump actually was launching that, one of their focus is to find the root cause of autism. And they've been having discussions, calling scientists and researchers. And this is what they found, which is very painful. Having researched a panel of vaccine experts and one of the chief of vaccination in America, the question that was asked is, are they aware that vaccines could be a possible cause for autism? And they said they are aware. The second question that was asked is, the vaccines that you administer to children, have you done enough testing in manufacturing process? You have to do clinical trials and have placebo trials to ensure that the drugs won't be harmful, either to children or adults. You have to do that. Guess their response. They said they never did any clinical trial to ensure the safety of the vaccines administered to children. Meanwhile, in my profession, I'm more onto research. We already knew this, but now if you would say it, many scientists in America were faced lots and lots of backlash. So in fact, some doctors were even, one doctor in particular, his license was withdrawn just for saying, would you please do proper clinical trials for the vaccines?
And I know that some parents were actually against vaccinating their children. There are some celebrities who decided not to vaccinate their children.
The thing is with parents are more like, your first primary nurses.
Absolutely.
When the child comes home back from vaccination, they observe them and they can tell if something has happened. So one of the biggest concern is, why are the parents being neglected throughout all this process? Why, when they bring their complaints, why are they labeled as anti-vaccine when in the first place they went there to vaccinate?
Right.
So currently, this conference and investigation that is currently ongoing, the doctors came out, and in fact, the pharmaceutical industry experts, all of them agreed that, we have not done our due diligence. Now, there's something in the vaccines or any medication, drug. There's an insert paper that will list the possible side effects. And when you look at the vaccines, they clearly listed there that vaccines have a possible side effect of neurological development. It could be ADHD, it could be autism, it could be delayed speech, it could be any form of neurological development. But the sad one that I've seen in Lesotho, which, coming back to the diet thing, is because most of the parents observe breastfeeding, autism is not so impactful, because the mother's milk is like magic. It has almost everything from healthy chemicals that help to oxidize the body and repel free radicals, from building the immune system. It's just magic. So because of breast milk, the impact of vaccination is not so adverse.
I see.
So, but now, what has happened, and talking to most teachers, they say the current kids they see in class 2, class 3 are really dumb. You try and explain 1 plus 1 is 2, ask them, they've forgotten. And that in particular, hearing that from most parents, was one of the things that led me into saying, what, I want to pursue research as a biomedical scientist, but with a focus of mental health, and with a focus of seeing to it that the next generation of children can be smart. Because if we have dull children, what is going to happen to our country? They're going to sell the whole country as if they happen to go into politics, they're going to really do lousy decisions that will affect the country. We are already compromised.
Yes. And that's a concerning statement to make, really. It's a concerning statement even for parents as well, because at the end of the day, you really want to hear encouraging, supportive statements from that sector. But now let's break it down a little bit in a way that we probably will understand a little bit more. Is there a link between what we eat, and you've also mentioned what we apply? It's not only just what we eat, but also what we apply on our bodies to mental health. And you can just give us some examples as well.
Okay. There's a huge link between what we eat and our mental state.
Right.
Let's take an example, a very general example that everyone would understand. Try in the morning and have a heavy meal like papa, galibis, and then on another day just take a mixture of herbs as salad, and observe, do your own analysis and see ha o jele papa le ha o jele di-salad, which day are you going to enjoy more energy throughout the day? Which day are you going to be more relaxed, more calm, more social? And you will notice that things like heavy starch in the morning, they make you crampy. And now let's take a series of days where you are crampy. That will eventually lead to a personality where now we say, don't talk to that one in the morning. They're a bit crampy. But that in itself didn't just come out of nowhere. It came from the breakfast you ate.
Right.
It could come from, I was amazed just recently. I was changing a deodorant. I applied a new one. And I was surprised that after applying this new one, my mood changes. My mood changes and I have a bit of a headache. I'm like, I'm not happy as I was 5 minutes ago before applying this. So our body allows nutrients and chemicals through the air we breathe, through the skin, through the food we eat. So really, there's no way we can maintain healthy mental state without looking into what we eat every day. In China or Asia, generally you would say we have a saying that in Asia kids are smart, but we have not really said what do they have. And one of the products or supplement they have in Asian country is ginseng. That in itself empowers the brain, helps the brain to think faster, aids in memory. And when you take a child who's been supplementing or who has ginseng as their staple food or supplement, which they have any day, and then you take a child who is just on wheat and maize meal, there will be a huge difference. Back in the days in Lesotho, sorghum used to be one of the staple food. And at that time, when we used to have more sorghum, our brains were sharp. And really, we should go back to replacing maize meal with sorghum. Because, in fact, some scientists believe that sorghum is a superfood. Superfood is a food that has more minerals and vitamins than an ordinary than other foods. So if the Ministry of Education, for example, would introduce foods that are derived or formulated from sorghum, you'd see a huge change. You would see a huge change.
Oh, that's interesting.
In America, some scientists had to face the government, and they did a research, and they found that in insurance formula food, there is tons and tons of heavy loads of mercury. So these people work as a system. Not only will they give you toxins via vaccines, they make sure that if you skip that, at least you get toxins in formulation. If you skip that, you get them via diapers. Diapers have been now analyzed, and they found that not only do they have chemicals that will later on cause cancer, but they also have some heavy metals. So I won't go deeper on that, but I would encourage parents to try and find diapers that are being made of bamboo or something just organic. Back in the days, sono serviso maliri, and maliri anzoka cotton.
Yes.
And that in itself produced, if you check children born in the 80s, versus children born now.
Mm.
There's a huge difference. We handle pressure a whole lot better.
Yeah.
Affected and other things, but but
Thank you so much for joining the Faces of Mental Health, and please join us again for more mental health content. Please like and subscribe, and also share and engage with us. Until next time.